Hello, friends. Welcome to Pillar 2, Module 1. So, now that we've spent some time learning how to listen to our bodies, the next step is looking a little more closely at one of the most important systems influencing those signals, and that is the gut. A lot of symptoms women experience in midlife, things like fatigue, brain fog, bloating, pain, skin irritation, anxiety, even food sensitivities, often have something in common. And many of them are connected back to gut health and inflammation. We have to remember that our digestive system actually does a lot more than just process food. It plays a big role in metabolism, hormones, immune function, and even brain chemistry. So, when the gut environment becomes irritated or out of balance, inflammation can increase throughout the day and symptoms often follow. And this becomes even more important in midlife. Hormonal shifts, years of accumulated stress, diet patterns, medication, environmental exposures, all of these things can start to affect the balance of the gut's microbiome. But here's the encouraging part: the gut is also one of the most responsive systems in the body. So, when we start improving the environment inside the digestive system, the body often responds pretty quickly. Energy stabilizes, digestion improves, inflammation begins to calm. And to guide this process, we use something in functional medicine called the 4R protocol. The four steps are remove, replace, re-inoculate, and repair. Each step builds on the previous one and gradually creates an environment where the gut and really the rest of the body can start to heal. In this module, we're focusing on the first step, which is remove. So we want to remove and identify and reduce the things that irritate the gut and contribute to inflammation. So for most women, that includes things like ultra processed food, excess sugar, alcohol, and sometimes foods like dairy or gluten, depending on the individual and their sensitivities. The goal here isn't perfection. The goal is simply to reduce the inflammation load on the digestive system so that the gut lining has an opportunity to recover. Because the gut lining actually acts as a protective barrier, and when that barrier becomes irritated, something you may hear called intestinal permeability, substances that normally stay in the digestive tract can slip into the bloodstream, and that triggers inflammation. And inflammation can show up as many of the symptoms that we talked about earlier. So, the first step is really about creating a calmer environment inside the digestive system. Over the next few lessons, we'll talk and walk step by step through how to do that in practical, manageable ways. Because supporting your gut isn't just about digestion, it's about strengthening the foundation of your health. And when that foundation improves, a lot of other systems in the body begin to improve also. You will find that there are meal plans, grocery lists, meal prep ideas, and ideas for supplements, which are optional. All these things will help prepare you for the next four modules in Pillar 2 so that we can clean up our gut and get it feeling so much better, decrease that inflammation, and absorb the nutrients that our body needs to be healthy.